Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by cocaine." His answer, "I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face, which is why my urine was positive. MMMHMM. Got it." Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. Not a doctor but a nurse. Had a patient come in with a toothpick in his penis. Refused to tell me how it got in there, insisting he was picking his teeth, and it fell in. Nurse here. Had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I ask all the routine questions for this complaint. Lots of questions about his poop. Is it bloody? Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, x-ray. Everything comes back completely normal but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope, the kid just doesn't seem well. But we have no reason to keep him. We decide to watch him a little longer. Let him eat. The kid eats a bunch. A PBJ, apple juice, crackers, popsicle, no pain. So we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions and dad goes, "You know, for the past 3 months he's had a lot of worms in his poop." Worms. Fucking worms. You spent 6+ hours denying worms. I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears. Could not wait to tell my resident. Deworming medications. A shitload of wasted time and they were on their way. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them. It's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. How stupid can parents be? Don't they understand the risks? We have multiple outbreaks of treatable viruses that have been curable/manageable for 40 years thanks to the scientific breakthroughs with vaccines, and you're asking if they understand anything. Nurse here. Had a patient accuse me of shitting in her bed and threatened to sue me for malpractice. Keynote: she never got out of her bed. One of my lecturers told us a story of when he worked in ed. There was a man who refused to acknowledge or tell them how a jar got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering, but realized his BSL blood sugar level was off the charts. Really high. They were considering postponing the surgery to work out WTF was going on. When he ended up talking he told them the jar was full of honey before it got lodged and was rapidly absorbed by the rectum, causing the insane levels. What? Oh bother. This one is sad. From my old roommate. Girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they giving her a lot of pain in her last months. Did she live? I have no clue. Almost definitely died though. The lump was large enough that it was visible. This one happened just the other day. Had a patient come in looking pretty sick. Labs and vitals said the guy was in sepsis and most likely had a bad infection. The question was where, after some prodding and letting him know the seriousness of his situation, he finally admitted to the source of his infection. He didn't want to say it, so he just pointed between his legs. Looking underneath his underwear revealed a smelly, red, swollen, pus-draining scrotum. Some of it was even black and necrotic. Not a pleasant sight and it looked horribly painful. He went on to explain that he had a painful lump on one of his testicles a few weeks back. He was told it was an infection and given antibiotics. The problem didn't go away, and by then he had decided to take matters into his own hands literally. He tied a string tight around one testicle and proceeded to cut it out himself. Needless to say, it became horribly infected and was going to require surgical intervention. Guy ended up doing OK. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, "I think this is all a joke and you put it up there." Yeah, she was totally trying to cheat a drug test. Definitely. The bottle had an overly complicated apparatus which allowed her to discreetly trigger the urine to come out, which made it all the more weird. She pretended we had, and he just pulled Chatek out of her cooch. Pulled Chatek out of her cooch. Thanks. When I want to really piss off my wife, I call it a cooter. When she was pregnant, she'd put a hand towel on the edge of our tub to sit on and help her turn around into the tub. I called it her cooter scooter. Gwyneth Paltrow has officially gone too far. When was their last meal? They think they can fool their pets, can end up losing money, time, and over-irradiated. I feel your frustration to my soul. Sir, have you eaten this morning? Nope, not since before midnight. Meanwhile, I'm looking at a sliver of contracted gallbladder. Are you sure? Because I would hate for this test to come back incorrect, and you end up meeting with a surgeon when you don't need to. I might have had a couple of waffles and eggs. I'm a gastroenterologist. I do upper endoscopies all the time. Somehow, there are people out there who think they can get away lying about whether they've eaten since midnight before a procedure that will literally stick a camera into their stomach. Now, some people have gastroparesis and old food residue will be present in the stomach, but I've literally seen fresh, chewed but identifiable bacon and eggs hanging out in the stomach. In addition to probably making it a lot harder to diagnose whatever we were doing the endoscopy for, it's also a huge risk for aspiration events, which can be lethal. Recently diagnosed with gastroparesis. When I came to after the endoscopy, first thing doc asked was when the last time I ate was, then counted the hours that had passed from then until the time of the endoscopy, roughly 10 to 11 hours. Got to see the pictures of the procedure with the food still there in my stomach. It was gross and cool at the same time. The diagnosis sucks though, but that's just the luck of life. ______. I volunteer at an ER. Prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. Irk insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Edit: you can't get stabbed if you're not in the prison, and any sort of self-harm will land you on suicide watch, which is brutal as well. Weird sex stuff though, no problem. Prison nurse here. We see this frequently. Saw one guy who actually got stabbed and he was so oddly relaxed about the whole thing, making jokes. Normal BP, heart rate only like 80. Prison must be insane. Have you seen the movie Chopper? Hilarious scene when his friend in prison stabs him several times and Chopper's just like, "Oh mate, what did you do that for?" I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened, so he might as well just admit it. I used to do patient registration in the ER. Two of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance and my coworker takes it, so I'm finishing up some paperwork, and I go to our front office and pull up the patient tracker board, so I can see what still needs to be done, and a new patient pops up on the board. Chief complained, eyeliner pens stuck in penis. My coworker walks into the office looking scarred. She explained the nurse asked him what happened and he said he slipped. She told him that doesn't seem likely, so he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on television and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation, and I hope someone told him about sounding. And he did some research on safe practices for kinks/fetishes. Apparently they were both lodged in there pretty badly. Edited for clarity, sorry lol. Both. Chief complained, eyeliner pen ********************************************************************************************************************************************************************************************************************************************************************************************************************************************************************************************* Poor dude. They were almost 60 years old and taking a drug to make them lactate so their husband could pump them as it would help their fibromyalgia. Took a while for them to admit why they were taking it. I've thought about this for a bit and still don't understand. Why were they doing this? My guess would be a lactation fetish, or they have read too many mummy blogs about the miracle of breast milk and are actually trying to treat medical conditions with it. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. I've accompanied a blind friend to medical appointments a few times, and doctors are always giving her instructions in writing without reading the material to her. Wow, that's just poor care. They also print it quite large for her to read. I work with several blind PTS. I'd asked my company to pay for Braille versions of our material for those that could use it. I love my company because if it's best for they agree to it. Other than all the random things that end up in rectums accidentally, drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug/tox screens we do that come back positive for something and everyone is shocked, borderline offended it got into their system. I love the foreign body rectum stories. I have quite a few of my own from working a queue, but I always find it absolutely hilarious that all the men queues I've never seen a woman come in with it use the same excuse as to how it got up there. No, I didn't see the Febreze bottle when I sat down naked. Asterisk, 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 has mom drive him to her asterisk, asterisk, asterisk. I swear I didn't see the beer bottle neck down when I sat down last night. Asterisk, asterisk, beer bottle shatters and we have to clean up the pool of blood on the ground post-enema. Asterisk, asterisk, asterisk. It's 2019 y'all. Just go to a sex store. Don't shove random household items, asterisk especially asterisk hollow glass items, up your ass. No one cares what you do with your prostate. Just do it safely because it can literally kill you. Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. We say, we're gonna take some blood and find out what you've taken. He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed, but he insists he didn't take it. His drink was spiked. The old speedy bear slipperoo. All my friends play this trick on each. It's hilarious. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup ampersand, pointed him to the bathroom. I went to check on my other patients, ampersand came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you walk in there. Asterisk, asterisk, sink on full blast. Asterisk, asterisk. Oh yep, everything's fine. I go back to his room a few minutes later, ampersand he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay, my pee is always clear. PT is wheeled off the XRAY. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little hummy, you gotta do better than that. I had a similar case in the Pedzer. A 9-year-old girl was asked to give a urine sample and insisted she could do it herself. So off she went. When she came back, the nurses and doctor commented it looked odd, almost clear, and asked her a bunch of times if she really peed directly into it or if it was water, to which she said it was pee. Finally we asked her one last time and she admitted she peed into the toilet, then used the cup to scoop the pee out of the bowl. That she could actually see. We had this lady that came into the ER at least once per month, usually cheek pain. She was 30s, morbidly obese. She had seen multiple specialists, had her heart/lungs/G system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint either. Last time she got a trip to the retina specialist. When I examine her, I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, if If you have your feet up like you always do, then the neuro exam. I have her touch her nose, then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose, then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked, and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Edit, maybe it was factitus disorder. I tend to believe all her chest pains and crazy complaints were real feelings she was having due to a number of her social/psych issues. In the air at midnight, it's a lot easier to tell her it is a symptom of dealing with whatever social drama was happening in her life and that her eyes worked fine, instead of telling her she was lying to me for some gain. Either way, she was sick and needed reassurance. She was genuinely relieved though. On the finger to nose test, she touched my finger on the first try, but instead of a straight line she moved her hand back and forth about the 3 inches the whole way there, but directly there. My finger was probably 2 feet in front of her face. One of my favorite patients had conversion disorder. She thought she was paralyzed on her right side. I watched her wipe away a very real tear with her right hand when she was distracted. She really didn't realize she wasn't paralyzed. Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. That's not mine. I'm holding it for a friend. I literally just watched the Scrubs episode where Turk and Co. are looking at x-rays and they are laughing at all of the stuff that people stuck up their butts and wound up in the emergency room for. Then Turk sees a pen in someone's butt that he took from what he thought was the lost and found box, but was actually the S box where all of the unclaimed items stuck in people's butts go to. The Todd told him that it was the S and not the lost and found box, and he realizes that the pen that he took out of the box and then gave to Carly as a gift was up someone's butt. Wasn't it, Laverne? There's not a lost and found box. There's an asterisk S asterisk box. Wasn't it, Laverne? Asterisk MMMHMMM. Asterisk. Trauma surgery rotation. Surgeons are helicoptered out to the scene where a man is impaled on a tree. They are hoisted up to cut him down in conjunction with firemen. The branch lodged deep in his ass, and the surgeons return on helicopter. In the ed, straight to CT for pen scan. It's in there as in through his glute max, medmin, pelvic area, and the tip of this branch is lodged somewhere alarmingly close to the bifurcation of the iliac external and internal. He's hemodynamically stable and talking, saying, my ASSSSSS, I need meds. Her doc is like, no shit. Asks him what were you doing in the tree. His answer, I used to trim trees. But were you doing that today? No, but I used to trim trees. Tox is positive for meth, but it's time to get that baby out. So it's stat to or for I ampersand D and X slappish. I get to scrub in and see what it's all about in the or. The branch is indeed lodged between the iliac artery and vein at the bifurcation. Neither vessel is damaged. We proceed to remove wood chips and bone chips from the enormous hole we have excavated out of his ass, and no suturing practice for me because it's a wound book for this man who used to trim trees. In the following days he is in and out of the med-induced haze. We ask him over and over, yo, but what were you doing in the trees? His reply, I used to trim trees. He came clean about the meth use and other drug use. He started to look better and better as he basically detoxed before our eyes. He eventually left in as good health as one can be with a giant mass of granulation tissue where your ass used to be. Never told us why the fuck he was in that tree. It's well known in the earth that a patient with something stuck up his her/etc. but has no idea how it got there, or they fell on it. The weirdest thing I saw was a patient who came into the ed with a shampoo bottle up his butt. So, what brings you into the emergency room tonight? I shoved a shampoo bottle up my butt, now it's stuck there. No shame. I mean, you kinda gotta respect that level of honesty, until you remove it and find out it was conditioner. Then the guy runs out screaming, psych, I see your username is inspired by him. What a tribute. I'm a CT tech, and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has sex with men. Well, the blood test came back positive also, surprise, and the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her, and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. Edit, because I've gotten this comment a lot. The woman in the room with the patient was her so, and they had been together a long time, and the patient had given her so permission in writing to allow her to hear her medical information. Many of you are saying you shouldn't have told her in front of her so, and you're partially right in a way, but the patient had given her so that permission, and I did not question it. Had she not, I would have asked her so to leave the room. You can give anyone you deem necessary access or no access to your medical information. It's not limited to spouses. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc. But we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she did and take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator since she was getting worse. We cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that still took her a long time before she said, well, maybe I did take some drugs from a friend. Since then I've trusted no one when it comes to denying drug use. Edit, just to clarify, I'm not saying I think everyone is a drug addict. I'm just saying if you come in acting super out of it, you're probably going to get Narcan just to cover all the bases. Also, I'm aware that light seconds are not a measure of time. I use the phrase out like a light followed by the word seconds. Just confusingly worded, I guess. Shit, at least she admitted it after the Narcan. I'd say 90% of the patients I survive with Narcan in the still denied taking opiates. Sir, the drug I gave you only works if you used opiates. I do, and do no drugs. K. Everybody lies. I might be too late for the party. Also, English is not my first language, and I'm on mobile. I'm an internal medicine resident. Had a patient with sepsis that was being seen by the urology department. When I first read his clinical history, it stated something along the lines of infected wound in the penis. Patient claims he doesn't know how he got it. So I begin my assessment and ask him about his wound. Indeed, he claimed he didn't know how it happened. I decided that the priority was to stabilize the patient and I made some adjustments to antibiotics and other meds. Well, the guy went downhill. The sepsis became severe even though he was with the strongest antibiotics we had and 2 different vasopressors. His blood pressure was through the floor and eventually he needed intubation and went to the ICU. He managed to survive after a complete penectomy, and about 2 weeks later I saw him again. Turns out the dude was trying to get his dog to lick his penis and put on some peanut butter on it. Naturally the dog bit him. He didn't seek medical help for about 10 days before the pain and fever was too much. If we knew from the beginning that the wound was inflicted that way, the antibiotic would have been different, probably would have made a difference. I still feel sorry for that guy, but with a wound like that he is lucky to be alive. Edit, I should have said that a total penectomy is total removal of the penis. Sorry for all of you that went to Google Images. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citrus seeds/pits, so many of them. When asked why she put them there, she said, well, I eat a lot of fruit and wouldn't accept any responsibility for them being there. Wait, what? How the fuck did she get them all the way up there? The going theory was she put a straw in and then pushed them down that. We thought just pushing them in one at a time would be a bit scratchy, but we do, and no, she never admitted doing it. This is def the weirdest one in this thread, and all the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married, to be fair. The patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. Isn't it pretty typical to separate minors and parents when the doctor is about to ask about sexual activity? I remember when I was 15 to 16, my mom was sent out of the room so the doctor could ask if I was sexually active. This was during a medical mission trip to Guatemala. No real rules like that out there. I gave a very abbreviated view of the encounter, but the mother was very supportive throughout the appointment, so the attending thought it would be useful to have her there. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart or any other surgery. A lot of comments in here seem to be about your personal doctor visits. My comment was very specifically referring to major surgery. All I am saying is this: if you're going to land in the hospital for a significant amount of time and you are an alcoholic, it is to your benefit and safety to be honest about that, because the odds that you will withdraw in your time there is high. If providers know, they can plan to manage that so you don't withdraw. Last, sounds like a lot of you have run into shitty, judgy people in healthcare. We aren't all like that, and even the judgy ones really don't want you to detox on their shift. You weren't breathing, we gave you Narcan, you started breathing again, woke up, and then deny you used a narcotic. Yeah, alright. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago. During my peds rotation, parents would often say I don't smoke in front of the kids, but when your kid's hair smells like smoke. Edit 1. If you go near to listen to a kid's heartbeat, you're close enough to smell them. Edit 2. If you smoke anywhere in the home, even if in another room while they are in another room, you are still potentially exposing your kids to secondhand smoke. This increases their risk for diseases such as asthma. Edit 3. As Dr. House says, everyone lies. So I take everything any patient/parent tells me with a grain of salt. Asterisk. In front of asterisk. If they smoked asterisk in front, the kid's face would smell like smoke. The fact that it's their hair proves that the smoking is happening behind the kids. Also, I had a girlfriend in high school whose parents smoked in the house. They never did it in front of me, but the house was so coated with nicotine and there'd be that haze in the air if you came home and caught them snuffing their butts out that you couldn't spend more than a few minutes there without your hair and clothes reeking of it. Every time I visited, I left feeling nauseated from the house itself and smelling like I had rolled around in that ashtray. It's totally plausible that they're not smoking in front of the kids. That shit just lingers. I lived in a month-to-month for a bit that had been chain smoked in. Everything I owned smelled like smoke after I moved. There were a few boxes I didn't end up opening for months, and when I did, everything in them still reeked. The bathroom walls would run brown when the shower was on. No one I lived with at the time smoked. This was all just residual. Work in a cardiac cath lab. I hear the, "Oh, I'm not smoking anymore" all the time. I want to say, well then why do you smell like you have been rolling around in an ashtray?